So diabetes, and more so talking about type 2 diabetes, which used to be called adult onset diabetes, and nowadays it's called type 2 diabetes, because kids, sadly, are developing type 2 diabetes. Why are they developing type 2 diabetes? Right, because of their diet. And many people have been to a doctor, heard about some family member or whatever going to a doctor, and the doctor says you're going to develop diabetes. Your mother had diabetes, your father had diabetes, like you're going to develop diabetes, guaranteed. And the reality is that doctor, plain and simple, sucks. They're terrible at being a healthcare provider. They just want to treat your disease. They don't want to take the time to be like, oh, why did your mother, why did your father develop diabetes? Because of their diet, because of their lifestyle. Not like, just take this medicine, this pharmaceutical, the pharmaceutical is made so that you can, just keep doing whatever you want to do. Where you go to a nutritionist, you can eat whatever you want to eat, just dial it up. Dial up the insulin. You want to have that cake, you want to have that ice cream, just dial it up. Dial up the insulin, and that'll bring down your blood sugar. Disease manifests in the body for a reason, and it manifests in the body, one, because the body isn't being treated properly. Your body is not being treated properly. Somebody else's body, how they need to treat their body, that's how they need to treat your body. You need to treat your body how your body needs to be treated. You don't put diesel, in a gasoline car. Like, why? The body isn't made for it. The car isn't made for it. You have to treat your body the way it needs to be treated, so it's healthy. In terms of diabetes, anybody that says, you're guaranteed to get it, right, they're a terrible doctor. They're a terrible healthcare provider. You can make changes. I've seen it time and time again. Woman comes in, she's had diabetes for years, she's on insulin. Take the time to talk to her about diet, talk to her about why she's eating a certain way. Many times it's addiction. The sweet flavor is the kindness, the compassion that she's searching for, from a more societal, interpersonal perspective, and can get off of the insulin, can improve insulin sensitivity, and actually be healthy, actually be able to walk, actually be able to feel the waistband around your waist, actually be able to feel your feet, where the neuropathy goes away. And I've seen it time and time again. I just had a patient come in who he's had diabetes for over 40 years, and all he's ever been taught is to be reactive when it comes to giving himself insulin. How high is your blood sugar? Okay, take this many carbs. Take this many units of insulin. Right, how high? This many units of insulin. Not counting the carbs before and giving yourself the insulin, to manage, how the body reacts in terms of blood sugar, to how many carbs you're having. And to have a healthy diet, where the blood sugar is regulated, where they're not having, a fall in blood sugar, below the 50s, because they took too much insulin, and now they have to have, that soda or that candy bar or that, piece of, piece of candy, to suck on to get their blood sugar up. you actually take the time, to see how your body reacts. Nowadays we have, those blood sugar monitors that you can wear for 2 weeks, and you can really get very specific in terms of how your body reacts to different foods. It's checking your blood sugar every 15 minutes. How your body reacts to certain foods. You keep a diary of what foods you're eating. You keep a diary of your activity. You keep a diary of how you're feeling. And you can correlate, when you're starting to feel anxious or your heart is racing and you're not sure why. What level is your blood sugar? In terms of what's happening while you're sleeping. In terms of your blood sugar. You can get, a real hard data perspective of how your body responds. The diabetes tea that we make, it's clinically proven to improve insulin sensitivity, reduce blood sugar, reduce the side effects of abnormal blood sugar, when it comes to neuropathy and infection, that comes along with that, recurrent infection. So when it comes to diabetes, it just needs to be realized that it's not something that somebody has to live with. It's a disease of lifestyle. It's not a disease where you need some pharmaceutical. It's a process that happens in the body when you don't give the body the right diet, the right activity, the right nutrition, and you can change it and you can get rid of it, and that eliminates the propensity towards heart disease, stroke, kidney failure, God forbid, amputation, of toes and feet and limbs, God forbid. Food is medicine. Lifestyle is medicine. And pharmaceuticals have a place, but many times they're not needed. And they're not there to necessarily help you live a healthier life. Many times they're there because it's a business. And sadly, most doctors are in bed with the business mentality of healthcare. So, God willing, you give your body what it needs. Your body is holy. Your soul has chosen this body for a reason, and it should be a pure vessel for you to